We are Sara and Kristin Tompkins.
And we are Women's Health Ambassadors for the St. Francis Gala.
So my name is Sara, and I have moved here to Maryville about 15, 16 years ago. But Kristin was born and raised here.
I was. So I have done all of my women's health kind of just routinely here in town. So actually back in 2016, I would have gone to a regular health visit and was diagnosed with a condition and had to have a surgery through the Women's Health Clinic here in town. So it was pretty dire that we had that available here locally for me to have that done, which kind of kickstarted our whole...
Yeah, we were just started dating.
Our whole experience, yeah. So
yeah.
It definitely gave us a scare as far as the future of fertility for us. But we were also blessed to be able to work with a doctor here to hook us up with a clinic in Kansas City. Because unfortunately we started our IVF process in 2019. So then 2020 hit and things got a little rocky. And we ended up having to kind of extend our experience with a different doctor at the end of all of that. And we went through the entire process. It was grueling, but we went through the egg retrieval and had some issues with that. So most of our fertility was actually done in Overland Park. However, after that egg retrieval experience, we did have to end up in the ER here in Maryville. So we spent a little more time with the Women's Health Clinic here during that episode as well. So,
yep. We got home from the egg retrieval, and she just started passing out. So I had to call 911, and ambulance came, and they brought us to the hospital here. And they were really upfront and honest with us. And they're like, we don't have a lot of experience with egg retrievals or complications that could come with that. And so they immediately were like, we need to talk to your doctor, and they kind of advocated for us on our behalf and was like, we'd like to get him moved there just to be safe, because they were just really honest. We don't have the spaces here in Maryville to help with something if something were to go astray really wrong. So
yeah, their honesty really meant something.
Yeah, it did. It made
to keep our safety at the forefront rather than just wanting to keep everything in-house.
Yeah.
So it was definitely an experience, and we were so thankful that we had the resources here to deal with the emergency in the situation that we were in before we were then able to be referred down back to our regular position.
I guess we probably need to backtrack and talk about how, like, after egg retrieval, you go into... they fertilize the embryos, and we were super fortunate, and we had 5 viable embryos. So our very first transfer was successful, and that was Henry. And then we had a second transfer, and it was also successful on the first try, and that is our new daughter, Owen.
Yeah.
So
we've been very fortunate since that. We had that first little hiccup in the whole situation, and then after that, we really have been blessed with the outcomes of our IVF experience. So
I guess we should have talked about how we did start with 5 rounds of IUI that were unsuccessful before we went on to IVF. Those were grueling, and they kept telling us we're so young, we shouldn't have any issues. So we kind of kept putting, no pun intended, our eggs in that basket. And it wasn't successful for us, but we were really blessed that when we switched to IVF, it was just a totally different experience. Everything went really smooth, minus the egg retrieval, which was terrifying. One of the things that they don't tell you when you go through IUI or IVF, if you're going through any non-traditional method of reproduction, then one thing they don't talk about is like the kind of work you take off. Like, yes, you have to take off a lot of work, but they don't explain to you that it's no rhyme or reason to when you're going to have to take it off. You can't plan that ahead. Kristin's a hygienist, so she has patients that are planned and scheduled, and I'm a caterer. I have events that are planned and scheduled. And when you go through that process, they're like, okay, your body's ready, so trigger that shot and get down here to Overland Park as soon as you can. And so, like, you don't really get to make plans, and that's taxing on our employers, and we're both very driven in our careers, so it weighs on us as well. We don't want to be that employee for sure that just has to put all the weight on our coworkers. But that was a huge thing that I didn't understand, going into it, is that when you have to take off to go to Kansas City, it's like right then and there. There's no planning ahead, like, oh, you get a couple days and I can ask off work. No, it's like, okay, tomorrow you're coming down, and it's at 6:00 that night you got the results. So that was stressful for sure, and another level of stress to the situation, because majority of the time I couldn't be there for any of her appointments. I had to sit out in the car and wait. During her egg retrieval, I had to sit in the car and wait. So then when she was in the car and complaining about shoulder pain and all these things, I had no idea what happened in that room. I didn't talk to any doctors, anything. I waited in the parking lot, and they wheeled her out in a wheelchair, and I put her in the car, and we drove back to Maryville. So just lots of stress added because of the COVID experience for us. And then on top of that, like even when we delivered Henry, we were still, which he was born in 2022, and we still were the only two people that could be in the delivery room. We 100% snuck her mom in the room, and the nurses, you could tell that they weren't happy, but they also were super understanding and kind of turned a blind eye for us. It was our first baby. We were scared, and you need your mom in those moments. So
yeah, it was definitely a lot more than we had really expected as far as all of the hardships that come with doing the IVF process. They don't really discuss as much. Another thing was, insurance coverage. In certain situations, if there is a need for IVF, then they do a really great job of covering. However, if there's no medical need for the IVF process, like in our situation, sometimes those insurance companies throw it back at you a bit. So those kinds of things, you hear all about the IVF process more and more now these days than ever before. And I don't really think that we were as prepared as we probably could have been that first go round. But we were super fortunate, like we mentioned. So the second round, we were much more prepared for, and it was a lot easier, the burdens that came with it. So
I would say probably the biggest obstacle that same-sex couples fear is the financial. Like she explained, insurance companies don't work the same for us as they do for, a straight couple that is struggling conceiving, because it's a medical issue for them. So it's covered by more is covered, I should say, by their insurance company. Whereas for same-sex couples, we don't, it's not a medical need. So a lot more comes out of pocket. So that's probably the biggest obstacle for me. The biggest advice I would give you is, save up. Remember what's important to you and save. But they also have, loans out there and things that you can use that, saving's hard. We all know that it is. So there are other options and things that you can do to get to where you want to be. And Henry and Owen are both really perfect. You would have no idea. And my favorite joke is when people are like, oh my gosh, they're so cute. Thanks, we handpicked their features.
Yeah. Well, I would say that, if it's been in your life plan since you can ever remember, that it's worth dropping everything to figure out a way. And so that's what we've done. I went through a phase there for a while where I just wanted to be selfish and not have children, I think, like everybody else. But then you kind of top over that hill and you realize that, no, man, there's just so much more. So we definitely had planned before getting married to have children, and just knew that this was a path that we were going to stick to no matter what obstacles fell in our way. And there were many, and finances are definitely a big one that sometimes there's just not a way around it. But I just would say that if it's in your heart to do it, then there are many, many options and ways to get it done. So, and we're so thankful and so blessed that we did that, and we have the beautiful children and family that we have now. So
I would also say, how blessed are we that we think that the biggest obstacle for same-sex couples is finances instead of like social standards and things like that. Because we really do live in a community that completely embraces us as parents, like any other straight parents, and we have zero issues. We really do feel like we live in a community that is just full of cheerleaders for us, and that's been huge. And we also have a daughter named Chelsea. She's 16. It's actually Kristin's niece, but she's been with us since she was little. And I'm sitting there kind of debating on if I can do this or not. And she was like, well, why do they do this? And I was like, why do they raise money for women's health? Well, it's not because women are just somehow unhealthier than men. You know, it's not, we're not inherently unhealthy. It's just that gap comes from underfunding, and that's from a research standpoint and a service standpoint. And to think that it doesn't affect everybody is ignorant, because, I mean, I don't think it's an understatement to say that women are a majority of the glue to most family households. We're 50% of the workforce. I mean, so ignoring and underinvesting in women's health is, you know, it leads to repercussions that affects all of us, communities, both socially and economically. And educating Chelsea on that and realizing, you know, that girls don't understand that we're at a disadvantage, and it's not just because we're inherently unhealthy. It's because, you know, a history of underfunded medical research in women's health. So I'm happy to be a part of that, and I was proud to tell Chelsea, you know, that we're in a community that doesn't turn a blind eye to that, but recognizes that and takes action and tries to correct that here. And we both feel very fortunate that we live in a community that puts women's health at the forefront.
I guess growing up in town, you know, you see people doing these types of things, and being in the generation now that it's my turn, it's kind of important now more than ever that I do kind of put myself out there and do something to better the community that I grew up in. And so this women's health is very important to us, obviously for many reasons, but IVF and our fertility experience being kind of at the top of that list, and just putting it out there that there are those possibilities and it can get started here in this small town. I just think it's important that everybody gets to know that kind of experience has been had here.
Yeah.